The Nexus NeuroContinuum is a program that is able to encompass a patient's neurological recovery through all of the stages of medical rehab through to function. They can come into the NeuroContinuum as early as the ICU, and then as their medical needs stabilize, the continuum goes all the way out to community reentry. As they move and progress from unit to unit, we're just building on that trend of recovery.
The importance of the NeuroContinuum is continuity of care. The focus on that individual and knowing where he and she have been every phase through their walk out of the injury. And it's that whole continuum of care is what keeps it together, because you're not changing doctors all the time. You don't have to get to know a new set of faces. That 1,000 tests aren't going to get reordered because you know what's been done. And then there's a way of knowing the kinds of therapy that's been done so that we can use that as a stepping stone in the next program to build on something, not start over all over again.
As a part of Nexus Health Systems, we have 4 facilities over 5 campuses in the Houston area as well as Orange, California. Nexus Specialty Hospital has 2 campuses in Shenandoah and in the Woodlands, Texas. The Shenandoah location is a 54-bed adult specialty hospital with a 6-bed ICU, step-down telemetry unit, and medical surgical unit. There they focus on really stabilizing a patient that may be taking a longer time to recover than the traditional acute care hospital is able to provide. That's really the main focus of that campus, is medical stability and really starting rehab as soon as possible. Hopefully, patients are then able to transfer to our Woodlands campus of Nexus Specialty Hospital, and there the rehab program is really able to begin. We're hoping they're able to take advantage of several hours of therapy and that they're able to participate in groups. They have a specialized neurotherapy team there to take care of those patients. Once patients are able to graduate from the Woodlands campus program, it's our goal to get them to Touchstone. There are several houses at Touchstone as well as apartments that can really mimic the home-like environment so that patients are able to understand what it's going to be like when they return home following their injury. So at Touchstone, there's even a continuum built within the continuum. They can start out at one of our houses like Churchill or Windsor and then move through to community-based living and hopefully to the apartments with the ultimate goal of returning back to work. The other facilities we have are pediatric hospitals. The programs at the Healthbridge Houston facility are able to offer a very unique rehab program to kids. And then the Healthbridge Orange facility in California is specialized also in neurological rehabilitation, and they have a very comprehensive rehab program at that campus.
We hope that by providing continuity of care for the patient and the family, that we are providing ease of use. We hope that they feel that they are connected, that they've got key point people along the journey that they're working with, that they know that they can liaise with, so that they're always aware of what's going on with their loved one. That continuity for them, and that they feel like they're part of that journey as well, and that they know what the steps are that are coming and what the plan of care looks like, so that at each new juncture, it's not a surprise. Because we've talked about it, they're part of the team and it makes sense and they're ready for that transition to the next level.
The NeuroContinuum increases the overall success of patients by us really hitting hard on that neurological recovery early on in their acute care in the ICU while the patient still has a high level of medical need. We are already incorporating as much rehab as possible. As the medical needs come down and the rehab needs go up, that patient's already 10 steps ahead and is ready to just dive into that next level of care.
In my experience, when we're able to work with patients all the way through our NeuroContinuum, they have much better outcomes than when it's been piecemeal. Because when I've been able to sit with the family at the beginning and develop a rapport with them when they're in crisis, and they understand that I care, it helps them through a lot of the hard rocks that they're going to face along the way. And that they're going to know that I understand what they went through when they were by the bedside, grieving for what they never imagined could have happened.